So hello everyone, in this video we are going to discuss FMGE December 2020 pattern questions, and I must tell you that we are not discussing the actual questions as it is bounded by NDA, and the questions discussed here bear no resemblance to actual FMGE December 2020 questions, and any similarity is purely coincidental, and we are discussing purely hypothetical questions based on the recent FMGE exam pattern. So let's discuss FMGE December 2020 pattern questions. So first question is IQ level of 55 belongs to which of the following category? And it is a very straightforward question, and the answer for this is A, mild MR. Now you need to remember a table. I am just giving you a table and you need to remember it. So just write down level of intellectual disability. Now another one is IQ and another one is percentage of intellectual disability patients. So this table is very important and it has been asked many times. So this is very important. You need to remember this by heart. So just write down, one is mild MR, mild mental retardation. Another one is moderate. Third one is severe. And the last one is profound. So the IQ for mild MR is in the range of 50 to 70. And the percentage of intellectual disability patient which fall in the category of mild MR is 85%. Now for moderate MR, the IQ will be in the range of 35 to 50. And percentage of patient will be 10%. In severe MR, the IQ will be in the range of 20 to 35. And percentage of patient will be around 4%. And in profound MR, the IQ will be less than 20 and percentage of intellectual disability patient which fall in the criteria of profound MR is 1 to 2%. So this table is very important and you must memorize it by heart because many times questions has been asked on this. Now we come to next questions. The appropriate diagnosis for a patient presenting with 6 episodes of mania, depression, and hypomania in last 1 year is C. This is the diagnosis of typical case of rapid cycling bipolar disorder. And for the diagnosis of rapid cyclic bipolar disorder, we need 4 or more episodes, 4 or more mood episodes in last 1 year. And these mood episodes can be mania, depression, or hypomania. And we have made a separate video on rapid cycling bipolar disorder because it is a very important topic and many times question had been asked on this. So I will just giving the link in the description and you can find a link above also and you can just go to that link and watch that video. It is very important. We have discussed the rapid cycling bipolar disorder in great details there. It is not a case of cyclothymia or unstable or severe depression. It is a typical case of rapid cycling bipolar disorder. So just go to that video and watch it. Now the third question. A patient who is taking alcohol occasionally develops confusion and hallucination after appendectomy. The most probable diagnosis in this case is, see here, occasional alcohol use is just given to confuse you because alcohol hallucinosis is not seen in occasional use. In occasional use, it is not seen. It is seen in chronic use or abusers or those who are dependent on it. So alcoholic hallucination will not be the answer. It is not a case of schizophrenia. Now, see, There's a clear mention of confusion here. Confusion means altered consciousness. And you know that altered consciousness is a hallmark of what? Delirium. Okay. Delirium is defined by two things. It is acute and it almost always involve altered consciousness or fluctuation in level of consciousness. So it is a clear case of delirium, and delirium can be precipitated by surgery or infections. So this is a clear case of delirium, and it is not acute transient psychotic disorder because confusion is not seen in that case commonly, and it is not characterized by confusion, and we do not have other diagnostic criteria for acute transient psychotic disorder here also. So it is definitely delirium, and the word confusion should make you think that it is a case of delirium, and it could be seen post appendectomy or in surgery patient or in various other abnormalities also. Now next question is, a young woman having sleepless nights and being afraid due to feeling that her parents will die in accident is suffering from. Let's approach this question by a diagnosis of exclusion. I usually teach students that you must remember common things, and it will help you in many cases for applying the diagnosis of exclusion. See, is there any adjustment issue here? There is no adjustment issue here. So adjustment disorder is not a diagnosis. Is there any mention of any past traumatic event? No, there is no mention of past traumatic event. So this is not a case of PTSD. Now, why not obsession? You may think that she is having a recurring thought of that her parents will die in accident. So this thought is not an obsession. Why? Because it is not ego dystonic. It is not ego dystonic. It is not ego dystonic. The patient is not recognizing that this thought is ego dystonic. So this is also not a case of OCD. So what is the diagnosis here? It is a case of generalized anxiety disorder. And in GAD, the patient can have anxiety about anything, that something bad is going to happen, her parents will die, and sleep issues can definitely be there in GAD. So it is clear case of GAD. Now the last question, a child with age appropriate IQ and normal learning skills is poor in mathematics and getting poor marks in the appropriate diagnosis is. Now we will solve it by two approaches. One, by diagnosis of exclusion. So why it is not autism? Why it is not autism? Because there are no social interaction issues mentioned here. Also, in autism, we see repetitive or restricted kind of behaviors, which is not mentioned here. So this is not autism. In ADHD, that hallmark is inattention and hyperactivity. None of them is mentioned here, so it is not ADHD. In exam phobia, what happens? What happens in exam phobia? If there is exam phobia, it will affect all the exams, not a particular exam, not only mathematics exam. So it is not exam phobia. So what is the diagnosis? By diagnosis of exclusion, it is specific learning disorder. Now we will make the actual diagnosis. What is specific learning disorder? What is specific learning disorder? See, if a child is having normal IQ and he is having difficulty in any of these six categories, he will be categorized as specific learning disorder. One is reading. He is having difficulty in reading. Number two is understanding the meaning. He is able to read but not able to understand the meaning. Third one, spelling, spelling difficulty. Fourth, written expression, difficulty in written expression like grammar, punctuations, etc. Fifth is numbers, difficulty in numbers or calculation. And the sixth one is difficulty in applying the mathematical reasoning. So here clearly IQ is normal and he is having difficulty in mathematics. So maybe number or calculation and mathematical reasoning both are impaired or one of them is impaired. So this child is clearly a case of specific learning disorder. So I hope I discussed each and every question in great details, providing you nuts and bolts of diagnosis. Why should you make one diagnosis and why you should not make another diagnosis? And it is going to definitely help you in your future exams. Thank you.